The highly cited IHME model has swung drastically when it comes to projecting the United States death toll from COVID-19 from about 60,000 last month. Now it has more than doubled to above 134,000 just a few weeks later. Last week, and you can see where that has gone. So it's creeping up once again, now above 137,000 by August 4th, a figure that's largely attributed to increased mobility as the country begins to slowly reopen. Joining me now is Dr. Scott Atlas, senior fellow at Stanford University's Hoover Institution and former chief of neuroradiology at Stanford University Medical Center. Dr. Atlas, welcome back. Good to have you. So you have been a proponent of reopening the country because of all the other health concerns that you have. But what do you make of the fact that as we do that, according to this data, it says that they are seeing in some states a 20 percentage point increase in just 10 days of added mobility of people going out? That's a pretty big jump.
Well, they're not really seeing that, they're projecting that. And that's a very big difference. And it sort of highlights everything I've said from the beginning here, and many other people are saying, but they're sort of afraid to come forward. And that is that we're focusing on these sensationalistic modulations of a hypothetical projection model instead of using what we already know in fundamental assessment of what the cost of the actual policy is. The policy of total isolation is actually destructive and is literally killing people. I'll give you an example. 150,000 new patients with cancer are diagnosed every single month in the United States. That's not rule out cancer, that's cancer. Most of them are not getting diagnosed. Half of people on chemotherapy are not going in for their chemo. 2/3 of women are not getting their pap smears for cervix cancer. 2/3 of vaccinations in California's children are not getting done out of fear. There's this irrational fear that, frankly, the politicians, who are sort of medically naive themselves, have instilled upon the public at this bizarre sort of notion that it's stop COVID-19 at all costs. The story really is the cost of the policy here because it's destructive, it's harmful. The cure is bigger than the disease at this point. And that doesn't mention, by the way, the massive economic harms. For people who care about every life, what about the UN projection saying the economic lockdown itself will throw an extra 125 million people into starvation? We're not talking about poverty like the US knows. We're talking about less than $5.50 per day living. There is a massive destruction going on from a very sort of bizarre, almost irrational focus on stopping COVID-19, no matter what it costs. The curves have been flattened. We actually know how to do a targeted protection policy. Frankly, I'm wondering why it took 7 weeks after the lockdown of New York on March 20th to finally realize that the older, vulnerable people need strict protection with testing entrance into nursing homes, for instance. Yeah. A targeted policy is what many of us recommended, and that is the answer here. We can't just do this at all costs.
What about this discussion of a second wave coming in the fall? Do you anticipate that?
Well, I think it's not known if there's a second wave or not. I mean, I think that, Dr. Birx herself said the word if several times when there's discussion of this. And if there is, we are far more mobilized with our resources. We are far well informed about social distancing, and we know how to protect the people who are going to be hospitalized or have a serious illness and die. We've learned a tremendous amount. We don't turn our backs on the massive amount of evidence and fundamental biology knowledge about how to protect people just because a hypothetical model or this theory of potential second wave. I mean, there's a tremendous amount of evidence here. Public policy is based upon the evidence and common sense. And the common sense, we are witnessing really the absence of common sense and logic in designing public policy.
Well, it is remarkable to see all of the resources in medicine go towards one specific virus at the expense of all of these other ailments, cancer, mental health, you name it. So we'll see, as we follow this through. I hope you'll come back. Dr. Scott Atlas, good to see you tonight. Thank you, doctor.
Thank you.